Hey everybody, talking a little bit about recovering after surgery for Hallux Rigidus. Now this is going to really depend on the procedure that is being undertaken. And so for our lesser procedures and our more exhaustive or joint destructive procedures, they're going to be very different. Now when we're talking about our sort of more standard procedures where we're saving that range of motion, it means that you're going to be typically weight bearing or on your feet straight away. Whereas if we're looking for any of those fusion procedures, then I typically like my patients on crutches for 2 weeks just to make sure we have that bone all come together, and that's like the arthrodesis or the fusion of the big toe joint, and that'll just make sure that we're going to recover without having any injury to occur there. Now, if you are, going back to work, definitely for those lesser procedures, you're pretty well right to go back to a sitting job around that 2 weeks. And for this, I really do push my patients to have their foot up as much as possible. And that's going to really increase their healing rate by decreasing the swelling or the edema around the surgical site, meaning that they're going to get back to it, a lot quicker. Whereas if you're standing, it is going to depend on whether you've had one of those lesser procedures or a fusion type procedure. The patients really need to be aware that it can take a little while to get back to standing or weight bearing activity, potentially 6 to 8, but potentially longer depending on their role, particularly if they're going to be jumping around or on uneven surfaces. For those that have had an arthrodesis, it is likely going to take a little bit longer. Whereas those that are undertaking a kylectomy or with or without a Moberg, proximal phalanx osteotomy, most people are going to be back to more of their activities a lot sooner. And in those cases, we're putting people back into the joggers around 4 weeks, whereas the fusion procedures, we're looking around sort of that 6 weeks post-op. Most people will be walking for leisure, around that 6 weeks after a more minor procedure like a kylectomy, whereas those that have had a fusion or an arthrodesis are going to be taken up to around that 3-month period. Similar for sports, some people will be back to it at 6 weeks. I always remember some of my patients, back on the surfboard at around that 4.5, 5 weeks after a simpler procedure, but definitely I wouldn't be pushing at that stage. Whereas, most people with an arthrodesis getting back into, contact sports and high impact sports, I'm wanting them to wait that 3 months or so, just to really make sure that that bone has come together nicely and we're not going to have any post-operative complications there. But hopefully this has helped with the patients that you're seeing with recovering after surgery for Hallux Rigidus. If you've liked this video, hit the subscribe button, have a check of some of the other conditions and videos that we've got there. We'll see you in the next session. Cheers.